Hi, my name is Catherine Forquer, and I chose to do my community research project on increasing the proportion of adults with diabetes who receive a formal diabetes education. As the daughter of a diabetic, I inherited a 60% chance of developing diabetes at some point in my lifetime. So, this project was a great opportunity to show you guys a little bit about a condition I have been learning about my entire life, as well as dive into some resources in my community for not only myself, my father, but the rest of the community as well. So let's dive right in. What is diabetes? Diabetes is a chronic condition characterized by a lack of insulin production in the pancreas or by the body's non-response to insulin produced by the pancreas. We have got the two main subsets of diabetes, which are type 1 diabetes and type 2. Type 1 is also known as juvenile diabetes and is characterized by the pancreas not producing insulin or producing a very little amount. We usually see that occur earlier in life. Type 2 diabetes is also commonly referred to as adult onset diabetes. This is the type of diabetes where the pancreas is producing insulin, the body is just simply not responding to it. Other types of diabetes involve prediabetes, gestational diabetes, monogenic diabetes, and even less commonly medically induced diabetes. Now, prediabetes is the state of being right on that line of developing diabetes and getting out. With interventions, you can get rid of prediabetes. You can no longer be pre-diabetic, but without those interventions, you do have a very likely chance of developing diabetes in the very near future. And then we've got gestational diabetes, which is where a woman who is pregnant develops diabetes specifically around that pregnancy. So who is being affected? There are over 34 million adults in the US right now who have diabetes. 1 in 5 of those 34 million are unaware that they have diabetes. There are 96 million adults living in the United States who are in a state of pre-diabetes. 80% of that 96 million are unaware that they are in a state of pre-diabetes. You can guess that these are the reasons why diabetes is the 7th leading cause of death in the United States today. Why is this important? The number of people with diabetes around the globe increased from 108 million to 422 million from 1980 to 2014. That is quadruple the number in 1980 over a 34-year span. Diabetes is a major cause of blindness, kidney disease, heart attack, stroke, and lower limb amputation. In 2019, an estimated 1.5 million deaths were the direct result of diabetes. Less than 50% of people with diabetes ever receive a formal diabetes education. There are a lot of cultural considerations to take into place with anybody's care. But specifically with diabetes, we're going to want to focus on making sure that their meals are planned specifically to their taste, to their culture, as well as being aware of complications that may develop because of their culture. There are lots of factors that affect someone's motivation to seek out a diabetes education. Among certain cultures, there is a huge distrust of the medical community. So we have a lot of patients who do not want to seek out doctors' help. They may not be financially stable enough to afford hospital bills, or in Hispanic cultures specifically, and American Indian cultures, we see a lot of herbal remedies, homeopathic treatments that they trust more, that they believe work better, and trying to open up a more inclusive diabetes education for those people is going to be huge in catching pre-diabetic patients. If they do not reach out because they don't trust us until it is serious, we're going to see more of those complications, that neuropathy, getting sick, having a compromised immune system because of your diabetes, leading to being severely sick with cardiovascular disease, kidney diseases. We also want to look into who we are screening for diabetes. American Indians or Alaskan Natives, 14.7% of them have diabetes. So that is the highest among all of the races, just followed by Hispanic communities, which have 12.5% of which have diabetes. So we always want to make sure that we are taking that into consideration. So what are the benefits of a formal diabetes education? For one, it is scientifically proven that a formal diabetes education improves health outcomes, lowers the risk for serious complications. We want to make sure that we're providing our patients with a specific place to bring questions. A lot of patients feel as though they are burdening their medical team with silly questions, but when we provide them a specific place to go or person to go to with these questions for diabetes, we can kind of relieve some of that stress and make sure that they are asking those questions. It is just a place just for diabetes patients to go to, just to talk about your diabetes education. We want to bring awareness to some of the complications that come from diabetes. If you are a patient and you're diagnosed with diabetes and you never receive that education and you are never told of those complications, you have no way to treat them or avoid them. So this is when we see a lot of people with the neuropathy. They have a lot of feet problems. That's where we see all those lower amputations. We want to make sure that our diabetic patients are seeing a podiatrist regularly, that they are taking care of their foot health. If we can bring awareness to that, we can stop some of those complications. So, what are the resources in our community? We have the Halifax Health Lohman Center located just right next door to our college. They partner with the YMCA in both Ormond Beach and Port Orange to provide diabetes support groups. Diabetes support groups offer a non-typical environment for people with diabetes to come to. There's not as many medical professionals there. You're only going to get a diabetes educator there, as well as other people who have diabetes, and you can learn from their experiences. We can flush out some of those fad diets, and we can bring in what genuinely works for people like you, and that's why those diabetes support groups are such an amazing opportunity that we are lucky to have. We also have the American Diabetes Association, as well as having a huge online platform of education. They also have a direct connect program. So all you have to do is type in your zip code and they will provide you with a list of doctors, hospitals, education programs that are accredited in your community for you to reach out to. We also have the online referral request program through the Lohman Center. So all you have to do as a diabetic patient is go online and submit a request, and you will be prompted with referrals to podiatrists, to meal planning, to exercise plans, anything like that you can find online. The Halifax Health Lohman Center, and specifically, they are the Diabetic and Endocrinology Center. They have a huge focus on prevention, knowledge, managing, monitoring your diabetes, medicating you, nutrition. And they even offer programs and opportunities for you to learn about self-injecting insulin and knowing the risks with that, making sure we're doing that safely, that you have all of that information. The Lohman Center was kind enough to bring me in and talk to me about their inpatient and outpatient services. They gave me quite a bit of information for this presentation, and I wanted to bring special awareness to them and everything that they are willing to do for this community, because this is a huge resource that we have, and they are incredibly nice and very willing to help. Lastly, we have my peer review article. I chose an article from the National Library of Medicine, which was Diabetes Mellitus, the Epidemic of the Century. This article focused a lot on bringing attention to the global diabetes rates. So according to them, I believe it's 382 million people around the globe have diabetes, and we're expecting that number to rise to 492 million by the year 2035. They also believe that diabetes is hugely impacted by prevention, and that we should be A1 screening everyone that we believe has pre-diabetes, and they focus a lot on connecting smaller community resources to create a global community of diabetes health experts and resources for those living in a state of diabetes. Thank you so much.